So, Dr. Fauci, what's the latest when it comes to COVID across the country?
Well, we're in a very interesting situation because although we've reached that peak that we had around the 4th of July in the summer when things were peaking, they're starting to come down. But unfortunately, we've reached a plateau of daily cases of approximately 70 to 75,000 cases a day. And we're still having over 1,000 deaths per day. So we've reached a point where we're starting to see in situations where the immunity of people, understandably, because that's what happens with vaccines, you're seeing a bit of a waning of immunity. We know that from the experience, which is much more temporally advanced than ours. When I say temporally advanced, is that the Israelis are about a month to a month and a half ahead of us in the dynamics of their outbreak and in the performance of their vaccine program. And they're starting to see, although still the vaccines are very effective in preventing severe disease and hospitalization and death, as time goes by, particularly among the elderly and likely sooner or later among everyone, we're starting to see a diminution and a waning of protection, so that when you look at people who get seriously ill and are in the hospital, given so many more people are getting vaccinated these days, that we're starting to see even people who've been vaccinated ultimately get seriously ill. Some of them, not, I mean, for the most part, they're very well protected. That's the reason why we're really pushing boosters, namely the third shot of an mRNA vaccine or the second shot of a J&J, because we're learning from Israel that when you do get a boost, you dramatically diminish the likelihood that you'll either get seriously ill, get hospitalized, or dying. So the main goal is to get the unvaccinated people in our population vaccinated, namely the 60 million people who have already not yet gotten vaccinated, and to get them vaccinated.
Okay.
To get the children who have not been vaccinated, and then ultimately to get the people who've received their vaccination, to have them get the booster. That's really in a nutshell where we are.
Got it. Because you'd hit on those two groups that I want to talk about right off the bat, and that is the people who are not vaccinated yet, because we are 20 some odd months into this pandemic, and we've had the vaccine for at least a year now, right? So the folks who have not gotten the vaccine at this point, when do we just say they're not going to get it and just leave them be?
Well, one, you don't want to give up on trying to get trusted messengers to give them more information, because the unvaccinated are not a unidimensional group. It isn't everyone who's totally resistant. There are some among them who really do need more information. And you get them private messages. They could be clergymen, they could be sports figures, they could be any of the above, who convince them by answering their valid questions about why it's important to get vaccinated. Point number one. Point number two, you appeal to their communal responsibility, because a lot of people say, I don't care, don't tell me what to do. If I don't want to get vaccinated, I'll take my own chances. But it isn't only about you. You're not living in a vacuum. That if you get infected, you may not get seriously ill, but you may pass it on to someone else who does get seriously ill. So we've got to think as a community, not as individuals in vacuum. And then thirdly, if you still don't get to them, that's where mandates come in. We would like to not have to mandate vaccines, but when you're dealing with what's good for the community, sometimes you have to sacrifice people's individual feeling that they can only make only make decisions just for themselves. When you're dealing with a pandemic, your decision affects not only you, but it affects other people.
So you're saying mandates, though, are after you have convinced these people to get it for society, or having a trusted leader tell them. We've had trusted leaders speaking. We've had this message out there that they need to get it to protect those around them. But mandates is really where the pushback is coming. How are you going to deal with that?
Well, you try and explain to people why it's important. Mandates work, Gigi. It isn't as if they don't work. United Airlines has mandated that their employees get vaccinated. They have greater than 99% of them have now gone to be vaccinated. Houston Methodist has done the same thing. Tyson's Food has done the same thing. So the way you get those people, even though you would prefer that they do it voluntarily on their own, when they don't, the government's corporate responsibility to society is the reason to do mandates. It isn't because we want to take away people's individual rights. You have a responsibility to society. You live in a society. You don't live in a vacuum.
I'm going to go to some of the questions that were sent to me that I need to touch on before I get to my other question, and that is Montgomery County, Maryland, because we cover the DMV, DC, Maryland, Virginia area. Montgomery County, Maryland has had some of the highest vaccination rates in the country, but that county is still seeing, and it's teetering between the substantial and the high transmission rates. So what do you attribute to this? And is it waning, the waning vaccine effectiveness over time that you mentioned? Is that to cause the cause?
Yeah, well, yes, there are a couple of things there. One is that many of the people in Montgomery County, and I work right here in Montgomery County at the National Institutes of Health, did very well in getting vaccinated early, particularly among the elderly. That was like a year or so ago. So right now they are quite several months into their vaccination. So they are seeing waning immunity, which gets back to the issue of why it's so important now that boosters are available for them to get boosted. But there's another factor there that get back to what I said about communal responsibility of the unvaccinated. As long as you have remember, even though we've done pretty well, if you look at the total population in this country, we still only have about 60% or so who have been fully vaccinated, and only about, I would say, 77 or so percent have received at least one dose, which means you still have a substantial proportion of the population, even in Montgomery County, that's not vaccinated. What does that mean? That means you give the virus ample opportunity to circulate in society. And when it does, even vaccinated people become vulnerable when you have a lot of virus around. That's the point.
So the transmission rate still in Montgomery County is substantial. Hospitalizations and deaths remain incredibly low, as you mentioned earlier, and looking at those national numbers. But the jurisdictions are making decisions using the community transmission metric. So which came from the CDC. Is it time to start using a different metric to make those policy decisions about masking and when to change that, when to have your mask on, when to take it off? And what metrics are you are most telling to you?
The metric is, what is the number of daily infections we have in the country? We have 70 to 75,000 infections. That is an absolutely unacceptably high level. As long as that level is there, individuals, even those who are vaccinated, when they are in indoor congregate settings and do not know the status of vaccination in the environment in which they are indoors, they need to wear a mask. That's it. When we get the level of virus in the community at a very, very low level, then we'll worry about getting the masks off. When you're in the middle of a pandemic, Gigi, you know, as much as I don't like to wear a mask, I'd love to not wear a mask. But when you're in the middle of a pandemic, that's no time to say, let's throw the masks away.
But Dr. Fauci, wait a minute. So you're not looking at the hospitalizations and the deaths, they remain low. So should we be looking, you're saying we're looking at the right metric?
Absolutely. Yeah.
Okay. Multiple states right now, they're allowing for booster shots for adults. Should all states be doing this?
You know, we rely on the recommendation first of the authorization by the FDA and the recommendation on the CDC. Thus far, with regard to boosters, what has been authorized and what has been recommended is that individuals over 65 those who have an underlying conditions, and those individuals who live in or work in an environment that puts them at high risk. That's the current recommendation for booster.
Okay.
Right now, as we speak, the FDA is looking at data as to whether or not to change that to everybody 18 and over should get boosted. Personally, myself, as a physician and as a scientist and a public health person, I think that uncomplicates things, and that's the way we should go. Although I respect the decision of the FDA and the CDC, and I anxiously await what their decision is going to be. But what I know from going out into the community and speaking to people, that they get confused who should or should not get a boost. And when you're confused, then you don't go and get a boost. Whereas if it was pretty simple that you tell everyone who's been vaccinated with a full component of vaccination should get a boost. When you say it that way, it's unambiguous and not complicated.
Okay. I got to hit on holidays and kids. Let's get to kids. Children 5 to 11 now can go and get the vaccine. I have 3 little ones. My oldest is 6. So when we're talking about these kids, we know that they don't get sick like adults do when it comes to COVID. And we learned that over the past 20 months, kids they're not getting severely ill. So can you compare this to any other disease that doesn't generally impact children in the same way as it does adults?
I'm glad you asked that question, because as a matter of fact, you made a mistake, Gigi, with all due respect, when you said kids do not get seriously ill. A lot of kids don't, but let me give you some numbers. From 5 to 11, there have been 1.9 to 2 million infections, 8,300 hospitalizations, and about 100 deaths among children who are 5 to 11. That is much more than the deaths in that group of influenza. And yet we vaccinate children for influenza. So there's a bit of a inconsistency there of people say kids don't get seriously ill compared to an adult, and compared to an elderly person. Absolutely, children have less of a chance of getting a serious outcome from COVID-19. But less does not mean zero. And that's one of the issues that you've got to take into consideration.
Oh, okay. So taking that into consideration, there are some parents who are, and they're not getting their kids the vaccine. Those kids are going to school with my daughter, who does have the vaccine. What
Right.
should I do as a mom? How do I protect her? What are you telling those parents whose kids are going to school with other parents who are saying, I'm not getting my kid vaccinated?
Gigi, that is precisely the reason why the CDC says, despite the fact that there is a authorization and a recommendation for children to get vaccinated, not all children should be vaccinated. And that is the reason why your child still has to wear a mask in school.
I got to get to the holidays, and I got like a minute and a half left. Holidays right around the corner. Families find themselves in a jam, right? Because I've been vaccinated. I have an uncle who has not and will not get vaccinated. Do I go to the Thanksgiving dinner with him? How do I handle that?
You tell him either get vaccinated, get tested, or don't come to dinner.
Just like that?
It's easy. That was quick.
Okay. Anything else you want to add that I might have missed?
No, I think we covered it very well, Gigi.
Okay. And then wait, really quickly, travel guidance for this holiday season. Does it differ from last year?
Well, it's much safer right now because so many people are vaccinated. Last winter, there was virtually nobody vaccinated, and we were in the middle of a surge. So getting on a plane is reasonably safe. When you travel, be careful when you go into an airport or a train station and you have a congregate indoor setting. That's when you should wear a mask. And you should wear a mask on a plane. In fact, it is required to wear a mask on a plane. So if you have to travel, members of my family will be traveling by plane to come to Washington to have dinner with me. All of us are vaccinated.
Do you really think, okay, I gotta go. But do you really think these people who won't get vaccinated, are we really going to change their minds? I mean, really, they haven't done it now. Are they
Right.
going to do it?
Well, Gigi, I hope we can, but if we don't, that's what mandates are for. So people who feel that way, I can understand the multiple reasons why they feel that way. But there's one thing they're not taking into consideration. They have a societal responsibility. Why don't we look at it like we're at war? Okay. When you're at war, sometimes you have to sacrifice your own personal wants and desires and things that you want or don't want to do for society. You want me to give you an example? Let's
No, but
turn it now.
you
I
look
don't
like
want
a
my great
bully.
example. It's too bad. Okay, you're gonna lose. Just
Okay. I don't want you to look like a bully, but the government does in that regard.
I'm not trying to look like a bully. I'm trying to, and I'm the farthest thing. Anyone who knows me, I'm the farthest thing from a bully. But there is a thing called societal responsibility. And I think the people who put aside scientists, societal responsibility, might look upon themselves as maybe being a little bit of a bully.
Thank you so much for talking with me.
All right.
Okay.
Talk to you
Have a
later.
good day.
Bye.